Well, welcome everybody to session 2A of the WIC Breastfeeding Curriculum Training Series. The question for today, for those of you who are just joining us, is tell us who your greatest support is for breastfeeding, parenting, or just supporting your life in general. So if you'd like to answer that in the chat box, that would be awesome. Okay, so today's lesson 2A, it's level 2 for our peer counselors, breastfeeding coordinators, CPAs, and DBEs. So we're going to go over a few training helps since it's been a little while since we met last. Make sure you mute your microphone unless you're speaking and turn off your camera. The reason we ask you to turn off your camera is because Zoom technology prioritizes video transmission. So when there is a big group of people on the call like there are today, and people have their videos on, it will distort the audio and the slides. And Kathy may start sounding like Darth Vader, and we sure don't want that. Make sure you close out any browsers or files that you may have open so that you can download more easily all the information I will be putting in the chat box. And feel free to ask questions in the chat box and use your Zoom emoticons. This is how your camera icon ought to look. It should have a red slash through it. This is not how your microphone should look. It should have a red slash through it as well. So go ahead and double check those icons right now and make sure that they are the way they should be. Also, just as a reminder on how you can access the chat, if you look down at the bottom of the screen, there's a blue arrow pointing to 3 dots. You can click on that. Once you click on that, a box will pop up and you will see the word chat. You're going to click on the word chat. Then you're going to click your down arrow in the blue box. And once you do that, you can click on everyone in the meeting. So remember, if you have any questions that are specific to your state, please contact your breastfeeding coordinator, contact your local IT department for any agency-specific technology concerns. And remember that when you signed on to Zoom this morning, that is how we capture your attendance. If you're watching in a room with multiple people watching on just one device, I will be dropping in a fillable PDF registration form for you to fill out with everybody's name and emails. Send that back to me, and that way I can count you as having attended, and you will all get the follow-up email. So these are the items that we, whoops, did I miss one? Yes, there will be a short evaluation survey that should pop up for you when you close the session. Please wait until the end to complete it. And if it does not pop up for you for some reason when you leave Zoom, just send me an email at melissa@everymother.org and I'll be happy to send you an alternative link. So these are the items that we covered way back when we did session 1 under WIC and breastfeeding, breastfeeding promotion, national initiatives, WIC food packages. And this is what you can check off in your WIC action journal. Under counseling, 3-step counseling, under preparing for breastfeeding, reasons to breastfeed, how milk is made, and lastly, under problem solving, supplementation. Whew, we covered a lot, didn't we? All right, and now I would like to welcome our state program coordinators. And Leslie, I will turn it over to you.
Thank you, Melissa. Hello and welcome to Level 2. We are so excited to see you and to start the training today. Before we get started, I'd like to say a few words about Breastfeeding Peer Counseling Program. Peer counselors offer an incredible service. They support, educate, listen, refer, and fill in the gaps in WIC's already amazing breastfeeding, chest feeding support services. This is valuable and doesn't replace other WIC support. It only enhances it. Everybody's role is important. Washington WIC offers PC services at 29 agencies. And in 2022, we had a total of 58 peers. The Washington Breastfeeding Peer Counseling Program has now been available for 15 years, since 2007. Yet, we still have Washington counties that do not have this program. I will add information to the chat if you're interested to see where the programs are located. We also want to acknowledge the community partners who have who have participated in the WIC trainings thus far. And we want to thank WIC staff who took the initiative to invite those in the community that also serve our WIC participants. our WIC community partners, such as MSS providers, RN staff, hospital doulas. We graciously appreciate their attendance. When WIC program staff partner with communities using the same language and science-based approach, we can work together to reduce barriers for our families. Have a great training. Kathy, are you ready for our eager students?
Yes, I am, and I am eager as well. Thank you very much, Leslie, for getting us off to a great start. And I also want to welcome all of you back to the beginning of level 2 training and all of our community partners who are with us today. You guys are a super important part of this process, and we are so grateful to have you with us. So I wanted to just say a few things about just a few preemptive comments. First of all, I want to thank all of you who have sent us such amazing photos of your families and your children. Washington State staff really blew up my email and my phone with all the photos that you all sent to me. We were so excited to see all of them. So thank you all very much. It's not too late to send photos. If you have a photo of your family, your fur babies, or just any photos of you with your other staff, or photos of you doing something you enjoy doing, a pastime or a hobby, something that's important to you, please feel free to go ahead and send those to me. You can send them to me at my email at Kathy@everymother.org, and Melissa can drop my email and my phone number, my cell phone number, into the chat box. If you want to text me, that would be great as well. Please don't forget, when you do send me photos, to please let me know 3 things. I need to know your name. I need to know your role, whether you work for WIC, and if so, what role that is with WIC, or your role in the community. We'd love to know the organization that you are with and what your role with that organization is. And finally, the city where you're located. That will help me. And if you wouldn't mind, also include that you are in the state of Washington. We're working with several other states simultaneously, so I'm getting photos coming from all sorts of directions, and I want to make sure I am putting your photo in the proper slideshow. So the photos you're seeing beginning today and continuing on through this series will be featuring all of you, and I hope that you enjoy them, and it's a way of maybe getting to know each other just a little bit better. I also want to thank all of you who were so prolific in the chat box in level 1. We had a wonderful time in level 1 of getting to know you all just a little bit better and participating in all of the interactive components. So today we begin the level 2 content. This section is designed, as you all remember, this is a tiered learning program. Level 1 is for everybody, no matter what your role is. Level 2 takes us a little deeper. So in level 2, we're going to be looking at supporting the normal course of breastfeeding. We'll be talking about how to get parents off to a great start with breastfeeding, positioning and latching a baby appropriately, some of those early strategies for success. Early strategies for success. We'll talk about reasons to breastfeed, some ways to help parents deal with some of their common barriers, and we'll also look at managing and preventing some of the common challenges that new parents might face. Today is going to launch this content, and we're going to begin today by talking about the role of our peer counselors in the WIC program. And for those of you in the community who are not very familiar with what a peer counselor does, I hope by the end of this session today, you'll know a little bit more about these incredible women and the work that they do, the passion that they have for really making a difference in the lives of new families. And then we're also going to be talking today about how the breast makes milk, a little anatomy lesson on how this process actually works. We're also going to talk a bit about some national initiatives regarding supporting breastfeeding, and in particular looking at workplace legislation and other laws and policies that can support our families. I think this would be a good time to tell you a little bit more about my background, but before I do, I'd like to learn a little bit more about who we have with us today. So if you would come to the poll that Melissa has dropped into the chat box. And if you would, let us know what you do for the WIC program. If you work in WIC, are you a CPA, which stands for a Competent Professional Authority? These are the individuals that do certifications of our parents for the WIC program and determining eligibility and then counseling them. If you are a peer counselor, you can let us know that. We also have a position in WIC called the Designated Breastfeeding Expert. We'll tell a little bit more about that role as well. These are individuals who have the scope of practice and the skills and training to assist parents who are experiencing more complicated and complex breastfeeding challenges. And then we have a lot of other roles at the agency level in administration. And if you work in the community, we would ask you to click on the other button and please come to the chat box and let us know the name of the organization that you are with. So we look forward to seeing that. We'll give you just a few minutes to give everybody a chance to weigh in. And I'm going to go ahead and get my slides ready to go. And it looks like about 3/4 of you have already been able to weigh in. So we'll give it just maybe about another, let's say another 15 seconds, Melissa. We have caught quite a few people from clicking the other box. So we're very excited to have all of our community people with us. All right, thank you very much for weighing in. And it looks like over half of you work for WIC as a CPA, a Competent Professional Authority. We also have a number of people just working in a variety of other roles in the WIC program, including quite a few peer counselors and DBEs, as well as state and local agency administrative staff. And then over in the chat box, I see we have Salima from the Family Health Center. We have Lydia from the Community Healthy, Moses Lake Community Health. We have Jessica, who's a nutritionist with Clark County. We have Michaela from Pierce County and Arika from Seymour Everett WIC. We also have somebody from the Moses Lake, Griselda from Moses Lake. So thank you all very much for weighing in today. So as I mentioned, this might be a good time to tell you a little bit more about really how I got my start in this field. Those of you who came to level 1 heard the bio, but that didn't give you the backdrop to how I got into this profession. So I actually got my start in the breastfeeding profession as a WIC participant myself, and then shortly thereafter as a peer counselor for the WIC program. I was actually pregnant with my 5th child when I learned about the WIC program for the first time. I had gone to church one Sunday. My husband is a Methodist pastor, and you know, my job was to sit on the back row with my 4 kids and try to keep them all still and quiet throughout the service. And remember one particular day, some of my kids were being a little bit noisier than usual. And after the service, a lady came up to me and she said, "Have you ever heard of the WIC program? I think it could be a really amazing opportunity for you to check out." And I said, "I don't know what the WIC program is." And I was thinking in my head like a candle wick. She said, "No, I don't know what it stands for, but it has to do with supporting families, and like they give healthy foods like cheese and juice and things along that line." And I remember thinking to myself, wow, we eat a lot of cheese in our family. This could be a really good thing for our family. So I told my husband I wanted to check out the program, and he said to me he was embarrassed about it. I felt like it was a government, you know, subsistence program, and he just, you know, was embarrassed about it. And I said, "Well, that's okay, but I'm going to go check it out. I really feel compelled to check it out." So I go to the WIC clinic. He dropped me off, and then he ran a few errands around town, said, "I'll come back and get you." I walked into the office to be certified as a pregnant WIC participant. And I was shocked at what I saw, because when I walked into the office of the nutritionist who was certifying me, there on the edge of her desk was a sculpture that she had created made out of cans of formula. And she had used the different colors of the cans of formula to create this kind of a geometric design on the edge of her desk. And I remember looking at that sculpture and thinking, what have I gotten myself into? And she kind of turned into Vanna White on, Wheel of Fortune. And she was saying, these are all the varieties of formula that we will provide in WIC. We'll start your child off with this particular version. If your baby has problems, we have soy formulas. And then if that doesn't work, we have all of our special formulas. And my eyes got bigger and bigger. And finally, she said to me, you seem a little confused. Are you okay? And I said, I didn't know that's what WIC was. I'm not going to be needing formula. I've come to the wrong place. I'm so sorry. I've wasted your time and my time as well. So I was turning to leave, and she said, oh, wait just a minute. You are expecting a baby, right? And I said, yeah. And she said, well, how did you plan to feed your baby? Now, I want to remind you, this was 30 years ago, 31 years ago to be exact. And in that part of the state of Mississippi where I lived at the time, the breastfeeding rate was like 2%. Hardly anybody was breastfeeding. So I'm sure I appeared to be somewhat of an anomaly to her. And she said, how did you plan to feed your baby if you weren't here at WIC for formula? And I said, well, I plan to breastfeed. I breastfed all my children, and I would be breastfeeding. And she said, well, I mean, you'll need some formula for backup. I mean, I don't know that you can just breastfeed. And I said, I just breastfed 4 children. They're all alive and well. I think I've got this. She said, really? You just breastfed 4 children? I said, yeah. And she said, well, I mean, you don't have to get the formula, that we also offer an amazing food package. And I said, well, yeah, that's why I came. And she said, why did you come to WIC? If you didn't come for formula? And I said, I came for cheese. And she laughed a bit, and I laughed, although I didn't know why it was funny. And she said, I don't know if we've ever had anybody just come to WIC for the cheese, but that is one of the items in your food package, along with other healthy foods. And she described everything, and I relaxed. I said, okay, so I don't have to get that formula. Oh no, you don't have to get formula. I'm just surprised. I've never known anybody who was able to just breastfeed before. And I realized, again, I was just an anomaly, but I went with it, and she gave me the vouchers. I got up to leave. And as I got my hand on the doorknob, about to turn the knob and walk out of her office, she called me back. She said, come back here a minute. She said, are you interested in a job? And I said, a job doing what? And she said, talking to women about breastfeeding. And I said, they pay people to do that? Because you'd have to know where my heart was. Anytime I was out in public at the restaurant or a grocery store, I would go up to pregnant people all the time and talk to them about breastfeeding. And I thought it was pretty amazing. I actually would get paid to do that. She said, yeah, it's a brand new program here in Mississippi. And we were given some money to hire a peer counselor, but we were going to give the money back because we didn't know anybody who'd ever breastfed before. And you walked in today. So if you'd like a job, it's yours. So I was hired on the spot. I was told I would be working around 10 hours a week, and I would be making phone calls from home, which was for me the dream job, to talk about breastfeeding, but do it from home in my own time where I could stay home with my children. So I thought I had hit the jackpot. I didn't care so much about the cheese at that point. I was just so happy that I had an opportunity. So I walked out to the car, and my husband said, did you get the cheese? And I said, well, I have a voucher. We have to go somewhere to go pick it up, and other foods too. But honey, I got a job today. And he said, you got a job doing what? And I said, I'm going to be talking to women about breastfeeding for the WIC program. I'll be calling WIC parents and talking to them about breastfeeding. And he said, they pay people to do that? And I said, yeah, they do. So that's how I got my start in the WIC program. I just happened to be in the right place at the right time. I walked out with the job, and, I have to say, I just fell in love with the WIC program. I really did. I fell in love with all that we do and all this program stands for. And I realized very quickly that WIC was so not just about cheese, and it wasn't just about formula. It was about being present with families, supporting them in their parenting journey, and connecting them to the resources that they need to make the best decisions for their family. I am so grateful to all that WIC did for me, but I'm also grateful for the fact that they hired me, because I fell in love also, not only with this program and with the families that we serve, but I also fell in love with the profession of lactation. I didn't realize that there was a profession. After I became a peer counselor, I learned about the International Board Certified Lactation Consultants. I wanted to be an IBCLC more than anything in my life, and I endeavored to do that. I became an IBCLC in 1996, and eventually ended up not only working at as a peer counselor, but moving on into other levels of the WIC program, working as a district breastfeeding coordinator, and then ultimately working in the state office, where I was able to make a difference for the WIC program throughout the state of Mississippi. And, you know, I used to think when I first became a peer counselor that someday when I grow up, I want to save the world for breastfeeding. And little did I know back then that saving the world was exactly what I was going to have the opportunity to do by working in this field at the international level. So I have worked as the president of the International Lactation Consultant Association. I have traveled all over the world doing training programs, conferences all over the world, and I've had the opportunity to work in my hat as the ILCA president, to work with ILCA affiliate groups all over the world to help them get their affiliates started and working toward, meeting their goals for serving new families in their countries. I'm now sitting on the board for the World Alliance for Breastfeeding Advocacy, which is also called WABA, the group that sets our World Breastfeeding Week theme every year. And now I'm able to do even more advocacy at the international level. So I'm just thankful because I got my dream come true, my dream job as a peer counselor, but also my dream of being able to make a difference in the lives of families everywhere. So I wanted to share just that little story about how things got started for me, so you know where my passion is coming from. I do love this program, and I think it is an amazing opportunity to make a difference for families. So with that, we're going to go ahead and start our slides. If you are a peer counselor and you would like to share your story of how you got started as a peer counselor, let us know that in the chat box. I think we'd love to know how you've learned about the WIC program and what you get out of being a peer counselor. We're going to focus now on the peer counselor, what the roles and responsibilities and scope of practice are for our peer counselors. We are not going to cover all of the content in this section, but we do want to hit some of the highlights that we felt was important for all staff to be aware of, so we can be making appropriate referrals to our peer counselors. Now, I thought it might be kind of fun to think for a moment about the things you do every day that are important in your life. So I wanted to talk first about what is the one thing you cannot begin your day without. So just another way of us getting to know each other a little bit better. So remember, there are a couple ways to access our word cloud. One is to click on the link that Melissa has dropped in the chat box. Or if that doesn't work for you, you can try copying the link and then pasting it into a separate browser. The other way to access this shared board is to hover your phone. Everybody who has a cell phone should be able to do this. So hover your phone over this QR code until you see a little yellow box appear around the QR code, and right below it you'll see a little button that will say ahaslides.com. You're going to click on that little button, and that's going to enable you to access this board. And tell us the one thing you cannot begin your day without. If you don't do that one thing, it may throw your whole day off. So I'm looking at some great ideas coming up in the chat box already. I see coffee has a big one. Breakfast is big. That tells me a lot of you have named, well, both of those as something you've got to have. You know, a lot of people do need their caffeine in the morning. Water, well, that's another good one. Music, I like that. Brushing teeth, happy thoughts. I like that. That is awesome. Just beginning your day with some happy thoughts, taking a little time to myself. I love that. Getting centered or grounded before you deal with the rest of the family and all the priorities of the day. Walking my dog, dog cuddles, skin care, Thanksgiving prayer. Ooh, I love that. My husband and I have a big placard above our bed that says start each day with gratitude. And I think that is an important reminder that despite all of the things that may be happening in our lives, there are always things to be thankful for as well. And it's a great mindset to get yourself in that zone of gratefulness or gratitude. Movement, it's another good one. Iced coffee, matcha, mouthwash, stretching, hugging my daughters. I love that. Red Bull. Oh, that's very interesting. I don't think I've met anybody put Red Bull on there. That's really nice to see. So some of you are being very specific about the caffeine that you need to get your day going. I see Bible devotion, hugs and kisses, reading my Bible, washing my face, doing my bed, black tea. Let's see what else. Cuddle with my cat. Oh, I love that. I wish my cat would let me cuddle. She's very standoffish. She wants to be very near me at all times, but she doesn't really care for much cuddling. Having a positive mindset, kiss with your husband or your partner and your family, meditation, a smile, giving thanks, speaking positive words to yourself, skincare, walking my dog. These are all fantastic. And somebody put a bunch of lovely little emoticons in there. I didn't know you could do that. So whoever did that, thank you for adding that and letting us know that that's an option. You put coffee, looks like fresh fruit, all kinds of luscious fresh fruit. So that's a great way to begin your day. Awesome. Well, thank you all for weighing in. Melissa, if you can capture a screenshot of this lovely word cloud, I'd like to be able to remember this.
Got it.
And somebody put check my phone. Thank you for being honest there. I will be honest, that is something I usually check pretty quickly as well. I want to make sure there's no text messages from my family, my kids, my grandkids that I need to be aware of. All right, so why do we want to start off thinking about what we can't begin the day without? Well, for one thing, it's just a fun way to get to know each other, but it's also a reminder to us that many of the participants that we serve in the WIC program, they often cannot begin their breastfeeding journey without support. They need all of us. They need their peer counselor. They need our dietary and nutrition staff. They need our breastfeeding experts, and they need our community partners, those of you in the community who are also seeing our families and providing support for them. So thank you all for weighing in. Let's talk a little bit about what a peer counselor is and how they make a difference. So peer counselors are simply mothers in the community with personal breast or chest feeding experience who provide information and support to other new parents just like them. You know, if you have children of your own, I want you to think back to how it felt to be a mother for the very first time. And for those of you who do not have children, or maybe you have a partner who has children, or you have maybe perhaps nieces and nephews, because you have siblings who have children. You know, when we think about parenting young children, I want us to be aware that many parents like to find other people who have been through a similar experience. And women in particular, according to research studies, they have found that women are hardwired in a very unique way. We are hardwired to be drawn to other women with whom we feel we share life experiences, especially when it relates to parenting. In fact, some of these studies have also shown that as women tend to cope with stress in their life by finding somebody that they can talk it through with, whether that's their partner or a good friend or a colleague at work. We look for other people that we can commiserate with, so to speak, somebody else who can identify with our experiences. And when we find that person that we can talk to about it, it gives us confidence in our ability to cope with the challenges that we are facing. Now, I'm not going to say men do not deal with stress in the same way. I think some men do cope with stress by talking it out. I've also seen in some studies that men typically tend to deal with stress by internalizing things a little bit more, and perhaps they think it through in their own mind, or maybe they look for some ways to get control of a situation by, going out and playing a competitive game of basketball with other guys, or they are maybe playing a video game where they are conquering, the monsters in the game. So men may have other ways of coping that may be a little different. There can be a lot of similarities as well. But I think it just is important to remember that peer counselors provide for participants on the WIC program that other individual that the parent can turn to who is facing maybe some similar challenges. This might be a good time to show a video. I do want to say that peer counselors in the WIC program must have personally breastfed at least one baby. They do not have to be currently breastfeeding, but they have to have breastfed at least one child of their own. We do look for peer counselors who are enthusiastic about breastfeeding and who really want to help WIC parents to enjoy a positive experience. In most cases, peer counselors would make some phone calls from home. They would be available to participants beyond the WIC clinic setting and beyond the normal 8 to 5 work hours, because we know that new parents often experience challenges that occur beyond the 8 to 5 working hours. In fact, I would venture to guess that the majority of problems even can often occur after hours or on weekends, and certainly on holidays. I can't even tell you how many home visits I have made on Christmas Day and on Easter and the 4th of July and Thanksgiving Day and other major holidays around the clock. So with that in mind, let's take a look at a video that we created that gives us a little more insight. This is going to help us to learn a little bit more about what some peer counselors say their job is like. And if you hear anything in this video that in particular just sort of jumps out at you or resonates with you, I would love for you to come to the chat box and tell us what that was.
WIC peer counselors are moms just like you who support you in your breastfeeding journey.
Peer counseling means to me educating moms about the benefits of breastfeeding and encouraging moms to stay on the track of, breastfeeding their babies and have that support, and just for them to continue with the journey, because a lot of moms sometimes get discouraged with the whole process and they quit. So we're there for them to support them, and it just means, for me, it's a lot, because when a mom lacks support at home, they have someone to talk to.
I extremely enjoy what I do, helping moms and just being there for them, knowing that they can call on me at any time. And my magic hour for me is between midnight and 2 a.m.
Helping moms understand what their body was meant to do and be successful at it, and embrace their bodies and motherhood.
Peer counseling to me is an opportunity for me to work with moms and babies and to help women to breastfeed and to encourage them and just to be that support person.
A peer counselor is somebody who has
been through probably a lot of the same struggles that another mom is with breastfeeding, and probably had support to make it through those struggles, and has a lot of knowledge as well as experience to really kind of be there as a mentor as well as kind of a friend to help a mom make it through those common struggles that women face regarding breastfeeding, especially in the early weeks.
I'm feeling I'm making a difference because I'm educating moms on stuff that they did not know. And without a peer counselor, I don't know if they would have gotten that information. So I feel like I'm making a difference because one, babies are gonna be healthier. That can impact the world, in my opinion, because there's gonna be less illness, less asthma, less allergies, all those benefits that we all know that breast milk has. So we're impacting people's life because they're gonna be healthier, and we're impacting the world because we're gonna have healthier people.
I view the job that peer counselors do as just imperative to fill the gaps. And what I mean by that is just that I feel like moms get information from all different sources. They get information from their family, they get information from physicians, from their physician, from their baby's physician, from people at the hospital. I feel like moms are just bombarded, with different information, and peer counselors, I feel like, just fill the gap in between all of these different information sources, and to help mom to be able to make a good informed decision and how to digest even all of the information they get. And peer counselors really just serve as that core support. So I feel like they really diversify themselves, and they fill all the different gaps of where moms need it, basically.
My peer counselor has answered a lot of questions that I've had. She's called me, she checks up on me, makes sure that she's where she's supposed to be with her weight, and just really answering the questions that I have.
They called a lot to check. I also used a pump because I was really engorged from her not eating for a while. And so they would just call and check on us, and then we started going to group, and I went to group ritually after that. I was there twice a month, and that's where I got my support.
Even if I was a little concerned, I was concerned he wasn't getting enough, and she was supportive, had me bring him in, and it's just great. She's kind of like a close friend, She just tells you, I'm so proud of you, and it makes me, because I don't really hear that a lot, so it brought, so she made it touched me, so I'm very thankful for her.
I'm really happy to have had the with peer counselor. It was just, even more than for breastfeeding, it was just nice to have like an outside person to call.
There was a mom who had a traumatic experience early in life, had 3 children who she really wanted to breastfeed, but having baby at the breast was not a pleasant experience for her. It really brought back a lot of those traumatic memories. So we got her a pump because she had tried to latch a few times and she had the same circumstance. And we built her up and we just encouraged her. She called me one day in tears, probably within the week that her son was gonna have this surgery, just crying. And I just initially thought this was not gonna be a great report. They were tears of joy. She was so happy, so excited, and so empowered that that situation didn't get to prevent this time for her. I will never forget just knowing that that really healed her as a woman and made her feel really complete as a mom, and to be able to have that memory of having her son at the breast.
So I know these peer counselors, and I've seen it multiple times, but these women are passionate. They care about not just you, but your child and your child's future. They want to do they'll bend over backwards to do what it takes to help you with this breastfeeding duration or the support that you need. So they're very loving, compassionate, and sincere about what they do.
All right. Does anybody have any thoughts about that video? Anything you would like to pop into the chat box? Anything that resonated in particular with you, kind of jumped out at you? Brenda said, loving, caring, and compassionate says it all. And I think that's a very good synopsis, Brenda, of these peer counselors. And I have done training with peer counselors in probably every U.S. state now. I have done trainings in every U.S. state, every territory, and many of our Indian tribal organizations. And there are always peer counselors in just about every training that I do. And you know what? This is true of virtually every peer counselor that I have ever met. I can't think of a single peer counselor I've ever met who wasn't like the individuals in this video, who were loving, caring, compassionate, really having a heart's desire to make a difference in the families that they are serving. One of the things in this video that always jumps out at me is the woman about halfway through. She was wearing kind of a orangish salmon maybe colored top of some kind. And she made the comment that her peer counselor tells her she's proud of her. And do you remember what she said? That meant a lot. It touched her because she doesn't hear that a lot in her life. And every time I see this video, and I've seen it many, many times now, of course, but that one mom and what she said is such a huge reminder to me that the families we serve depend on us. They really do. They are probably not getting that praise and support from a lot of the people in their lives. A lot of times a new parent is receiving a lot of advice. Here's all the things that you should be doing, or here's what I recommend that you do. And what that message tells to a new parent is, I don't think you're capable. You're not sufficient. You are not enough. You need me to tell you how to do this. Very rarely do people get support from family in terms of family members saying to them, I'm proud of you. You're doing an amazing job as a new parent, and I'm so very proud of you. And I think, it's just a huge responsibility for us and an opportunity in the WIC program when we're dealing with a lot of low-income people and people who may be dealing with a wide variety of stresses in their life, to hear from every single one of us at WIC and in the community that we're proud of them and that we know they are doing their best to do a good job as a new parent. That's a powerful message. So what are the typical duties for a peer counselor? So let's kind of review what the job description for a peer counselor is. And I do want to pause here. And Leslie, could you please confirm that the peer counselor job description I'm going to be showing is similar or fairly close to the one you all use in the state of Washington? Is that true?
That is true.
Okay, thank you for sharing that. So the job description I'm going to share is the one that comes with this curriculum. And I wanted to confirm that first. And we have those general duties or qualifications for a peer counselor. Our peer counselors are not hired one day and get on the phone the next day. They go through a very intensive training program, which includes now all of the content in both level 1 and in level 2. Sometimes that training is done in person, sometimes it's done virtually. We also often ask our brand new peer counselors to shadow breastfeeding experts. You might have been asked, if you live in the community, you might have been asked to be one of those people that a peer counselor could shadow. We've had peer counselors shadow lactation consultants at the hospital or lactation consultants in a private office clinic or in other organizations. They also might shadow the designated experts in WIC, our nutrition staff, and other individuals, so that they learn not only about the mechanics of breastfeeding, but they're learning how to talk to people, how to counsel people about breastfeeding. Sometimes we also provide assigned books or reading materials or videos. So the peer counselor training is rather comprehensive. They do not pick up the phone to start making calls until they have been trained. Their specific duties are to basically, we would give them a caseload of WIC parents who have been certified for the WIC program during their pregnancy and have agreed to be contacted. And the peer counselor then would begin making routine periodic contacts with all of the participants that they are assigned to on their caseload. They'll follow them throughout their pregnancy. They will be making more frequent contacts toward the end of pregnancy, and especially in that first month after the baby is born. In fact, right after the baby is born, they may be calling every day to see how breastfeeding is going, to hopefully address any challenges that may be arising early on, to help parents overcome those challenges and to be connected to sources of support. The peer counselor also will be present with that parent throughout the course of breastfeeding, helping them to prevent and handle some common breastfeeding concerns. Peer counselors typically will talk to parents, both pregnant and breast or chest feeding parents, by telephone, home visits, and sometimes hospital visits. In many communities, peer counselors will also go to the hospital to see new parents and meet and greet them, basically, and make sure that they are aware that they need to come back to WIC to be recertified. They may counsel parents in the WIC clinic setting, although I know since COVID, many WIC clinics have been doing a little bit more virtual work. Some clinics are doing some hybrid work. In fact, if you wouldn't mind, come to the chat box and tell me whether you are back to working in the clinic full-time and seeing patients, or whether you are still doing kind of a hybrid type of services. Peer counselors are available outside the WIC clinic and the usual 8 to 5 working schedule. They are respecting each parent by keeping their information strictly confidential. They maintain very accurate records of every contact they make with a WIC parent, and they refer parents according to our established protocols to the dietaries and nutrition staff, to lactation consultants, either at the WIC clinic or in the community, to the mother or the baby's healthcare provider. They often will make referrals to public health programs in the community, as well as to social service agencies. So our peer counselors are continuing that warm connection, that warm handoff to other individuals, basically to connect the dots so that we are able to surround our new parents with that strong circle of care, so our parents know that they're going to be followed and supported. Peer counselors attend and assist with prenatal classes and breastfeeding support group meetings. Many of these have now become virtual as a result of the pandemic and have not returned to in-person meetings again. Peer counselors also attend monthly staff meetings and additional ongoing continuing education so that they can stay abreast, if I could use that word, of all the latest evidence surrounding breastfeeding. So we ask them to sign that job description so they are understanding that these are their primary duties. If you as a peer counselor are doing some other things besides some of the things that I mentioned here, please feel free to weigh in the chat box and let us know some of the other things. And I will say oftentimes peer counselors do help with World Breastfeeding Week activities. They may also help with doing other kinds of outreach in the community. Sometimes they make home visits by accompanying nurse family partnership staff or other people who are going into the community. And I'm looking at the chat box and it looks like many of you are still doing a lot of work from home, doing remote appointments. Some of you are accepting in-person walk-ins, but are primarily still doing a lot from home, doing either phone or virtual certifications. I want to mention that, it takes a strong team not only to help families to meet their breast and chest feeding goals, but it also takes a strong team to provide support for our peer counselors. And each member of the WIC team, as well as our community partners, have a strong role to play in promoting the peer counselor program and making referrals to our peer counselors. So no matter what your role is, you are part of this larger team that will help peer counselors to do their job more effectively. So I wanted to talk for a moment about a few of the WIC roles for some of these individuals. And of course, our WIC director, both at the state level and at the local agency level, they are the ones who ensure that policies and procedures for the peer counselor program are being followed. They will be approving funding for activities and also approving maybe policy changes that can better support the program. One example that I will mention is a bring your baby to work policy. Many WIC agencies have established policies that allow the peer counselor to bring the baby to work with her for a period of time. We usually say when the baby is around a year of age or the baby is mobile and, opening and helping him or herself to the files in your file cabinet drawer, then probably it's time to find a sitter at that point. But really, it's been a great benefit for many peer counselors to have their baby at work with them. They can continue to breastfeed their own child for a much longer duration. They are often able to exclusively breastfeed for much longer durations because they have their baby with them all the time. Newborns typically sleep a lot of hours and don't require an awful lot of care during the day hours. So this is a great opportunity for peer counselors to continue to breastfeed. But it's also one of the primary reasons for bringing the baby to work is to model for our participants what breastfeeding actually looks like and what a breastfed baby looks like when that baby is fully breastfed. Peer counselors often will nurse their babies to model discreet breastfeeding, to show parents, how easy it can be, and to allow our families to vicariously experience breastfeeding for themselves just by watching our peer counselors. There's a lot of research that shows that when you are seeing these visuals, like a peer counselor nursing her baby while she counsels you, that it is activating that deeper part of your brain in the brain stem that triggers those feelings of not really knowing the difference between whether it's real and yes, actually you experiencing that, or whether you're actually just observing somebody else. So while the thinking part of your brain, your cerebral cortex, definitely knows that you are watching somebody else breastfeed, that deeper part of your brain is putting you in the shoes of that peer counselor, allowing that parent to vicariously experience that for herself. So peer counselors are very powerful when they are currently breastfeeding and able to do that. So the WIC director will help with policies along that line. Clinic managers are also available. That might be the same person as your local agency director or your local agency clinic manager or nutrition manager. They have various names. In some agencies, the peer counselor checks in with this individual when they arrive, and they might even receive their caseload from this individual. We also have breastfeeding coordinators in every local agency, and it's their responsibility to coordinate all the many breastfeeding activities in the WIC clinic, as well as outreaching and coordinating activities with community partners. So our breastfeeding coordinators usually have specialized training and experience in lactation management to help parents. They oversee all of the agency's breastfeeding activities, and sometimes they wear other hats. They may also wear the hat of the peer counselor coordinator, and this is the individual who monitors the day-to-day operations of the peer counselor program. They may also serve as the supervisor of the peer counselors. They may be regularly reviewing their documentation, receiving timesheets or other paperwork that your agency requires. And sometimes the breastfeeding coordinator also functions as the WIC DBE, or the designated breastfeeding expert. So I want to explain again, particularly for those of you who are just now joining us for level 2, that a local agency for WIC that operates a peer counselor program, according to federal guidelines, must have a designated breastfeeding expert on staff to help with problems that are beyond the training and scope of practice of our peer counselors. So the DBE manages more complex challenges as well as more complicated things. For example, maybe a mother is not latching her baby very effectively. Well, one of the results of poor latch is sore nipples. Sore nipples can become infected if the skin is broken. That could potentially lead to mastitis. And if the baby is not removing milk efficiently, then the baby is likely to not gain weight. If the milk is not removed efficiently, the mother may experience a decline in her milk production. So what started off as a simple problem that a peer counselor can definitely assist with can sometimes become very complex, having multiple problems going on at one time. So that would be an example of where the WIC DBE would step in to try to get to the bottom of the causes of all of these problems and to set a care plan with the parent for ways to resolve these problems. And then, of course, we have nutritionists on staff. One of the roles that nutritionists also serve is as a certified professional authority, or CPA. So I'll be talking a good bit about CPAs, and I wanted you to be aware of what that title is if you're not familiar with the WIC program. And I'm going to try to punt to Leslie here for a moment and ask if there's anything else about the role of a CPA or nutritionist that you would like our community partners to be aware of. What do they do in the WIC program?
So the only thing that I can think of right now is that I'm not sure if you mentioned this, but sometimes our peer counselors are also CPAs in dual roles.
Okay, thank you for saying that. That's exactly right. I understand that in Washington, you do have a few peer counselors who also work as a CPA. CPA is going to be certifying parents and their infants or children for the WIC program. They are going to address nutritional questions that the parent may have, and they also help prescribe the food package. And we like to tailor the food package to the specific needs of that particular parent and their child. And certainly we have sometimes some registered dietitians who also are able to handle more complex nutrition questions and challenges that can sometimes come up. And then, of course, we have our support staff. Their primary role, they may be serving as clerks, as appointment clerks. They may be setting appointments with families, answering the phone, processing paperwork to begin that certification of the parent and the baby or the children. Sometimes this person is the first face of WIC. They are probably the first person to learn about problems that the mother may be experiencing, and they may be the first one to know that the baby has been born. They may be the first one to find out that the parent needs a breast pump, or that the parent is breastfeeding, but also would like to pick up some formula. So our support staff are really key parts of our WIC team because they are in a position to make all of those appropriate referrals. Let's talk now about scope of practice. And I like to remind our peer counselors that all healthcare professionals typically follow a scope of practice. So physicians, nurses, midwives, dietitians, nurses, lactation consultants, we all have a very defined scope of practice. So what is the scope of practice? Well, this is a picture of my grandson, Paxton, and I'll tell just a little background on this particular picture that I took of him. I had this long driveway when we were living in a community just on the outskirts of Jackson, Mississippi. And one day, Paxton was at my house visiting, and he was riding the little tricycle that I keep there for children to ride. And as he drove down the driveway, my grandkids used to love that driveway because it was long and just was really cool for them. But he was driving down the driveway with his arm outstretched, and he was jabbering away. I don't know who he was talking to or what he was trying to say, but he was getting into it. When he came back up after driving down to the end of the driveway, I asked him, I said, Paxton, who were you talking to? And he said, Nana, I was talking to all those other cars. And I said, Paxton, what were you saying to all those other cars? And he said, I told those other cars, you stay over there. So he's gesturing like he's going to make a left turn, but he was actually telling them, you stay over there, because he said, Paxton is riding my car down the road, so you have to stay over there. And after he told me that, of course, I took a bunch of pictures of him riding his trike. I began thinking about the analogy of what that means for our scope of practice. And what I've come up with is that, this kind of reminds us that with a scope of practice, we're going to stay in our lane. And, when we're all staying in our respective lane, we can travel side by side very easily. We can all provide different levels of support to our families based on the lane that has been identified for our professional role. So we also have a scope of practice for peer counselors in the WIC program, a very defined scope of practice. And I want to remind our peer counselors on this training that whenever a parent needs to be referred to another healthcare professional, that doesn't mean your job ends. You are still traveling right alongside all of the rest of the care professionals that are fighting for this mother as well. So the scope of practice is the range of services or support that you are allowed to provide as a result of your particular role or your particular credential. So I just wanted to mention that a scope of practice has been determined and set up for all of these different professional roles because it's a way of protecting the public. When a peer counselor and a DBE and a provider and a nurse, whenever we all know what our role is, it ensures that parents are going to get the right kind of care from professionals who have the right kind of experience and expertise. That is going to bring about the best positive outcomes for our families. It also protects our peer counselors. WIC agencies take out liability policies to provide protection for their staff in case a participant becomes upset about something that may happen to them in WIC and decide to, take some sort of legal action against that individual. But I will tell you that most liability policies protect staff as long as they are operating within their defined scope of practice. If they are not traveling in their lane and they are functioning and doing things that are beyond their level or beyond their range of services, then those liability policies may not provide protection. And we think it's very, very important that our peer counselors be protected in as much as possible. So with that in mind, let's kind of review what the scope of practice is for a peer counselor. And before we go into this, Melissa, could you post our second poll of the day on scope of practice for peer counselors? And let's just get some of your ideas. You can check everything that you believe is part of the scope of practice for a peer counselor in the WIC program. Here are the options. The first one says recommending medications that are compatible with breastfeeding, helping a parent position or participant position and latch their baby, encouraging a pregnant parent to breastfeed, making a referral to the WIC CPA for a food package change. Sometimes mothers start out breastfeeding, they get assigned to that food package, and they decide, no, I need to also pick up formula. So if that occurs, would it be their scope to make that referral to the WIC CPA for that? I just wanted to explain that. Advising a parent on how to manage mastitis, which is a breast infection, suggesting herbal treatments that can help build milk production. And finally, offering suggestions for getting a good start with breastfeeding. So we'll pause here and allow you all to weigh in and let us know. Click on everything you believe is part of the scope of practice for our peer counselors in WIC. And I'll point out that there are other agencies that may have peer counselors. We've learned that there are a few hospitals that that also provide that, peer counselors. And they're not necessarily WIC peer counselors. They may be patients who decide they want to help other patients. So I'm aware of a few hospitals that are doing that. And other community organizations have also adapted that model as well. But for WIC, what is their scope of practice? All right, let's give it, Melissa, about 10 more seconds. So you guys weigh in quickly if you can.
All right, the results are shared.
All right, thank you very much. All right, so this shows that the vast majority of you believe it is the role of the peer counselor and part of their scope to help a participant position and latch the baby, to encourage a pregnant person to breastfeed, to make referrals to the CPA for food package change, and to offer suggestions for getting a good start. Those of you who checked that, any one of those four were absolutely correct. These are all part of the scope of practice for a peer counselor. Now, there were some differing opinions on the others. The others are not part of their scope. So I'll mention all three of them. The first one is recommending medications that are compatible with breastfeeding. And I want to just say that it is beyond the role of the WIC program in general to be recommending medications. And it is actually beyond the scope of practice for me as an IBCLC to be able to recommend medications. Dietitians cannot recommend medications. Nurses cannot recommend medications. That is only the role of a provider. Now, a question sometimes comes up if a mother asks if it's okay to take a particular medication. Is it safe for her to take with breastfeeding? And the answer to that question is, if that question comes up from a participant, a peer counselor will need to make a referral to your DBE. That is beyond a peer counselor's scope to tell parents whether it's okay or not to breastfeed. The reason for that is that as peer counselors, as WIC staff in general, it's actually beyond the role of a DBE to tell parents, you know, you might try taking Tylenol, you might try taking a probiotic, you might try X, Y, or Z. We do not know that person's medical history. We don't know all of the other medications that this person may be taking. We don't know if the combination of certain medications that the parent may be taking, when we add this other medication onto that, is that going to produce any adverse reactions? Or can the medication we think is perfectly safe to take, is that going to cause another medication that the parent is taking to not be as effective? Unless you have a doctorate degree in pharmacology, you are a doctor of pharmacology, or you are an MD, you do not have that expertise to know whether those drugs are safe for people to take. So we are going to punt these questions back to the provider. What I will say is I advise peer counselors and our nutrition staff and CPAs to punt that question back to our DBE hand that off. The DBE can provide resources to the provider directly and let the provider know that the mother is wanting to breastfeed. And here's the information we have on this medication, but of course we don't know what else the mother is taking. We don't know any of her medical history. So if you could please contact the mother and let her know whether that you would approve her taking this medication, that would be great. So that's a really, really important distinction that I want to make. And the same thing is true with herbal treatment. Sometimes people think an herbal treatment is benign. It's fine to recommend herbal treatments because they're plants. They come from the ground, right? Well, you know, a lot of medications come from plants as well. And we have to be very, very careful. There are a lot of herbal treatments that mothers may want to take. Maybe they went to one of those whole food places, stores or nutrition stores, and somebody told them, oh yeah, to build your milk production, you need to take X, Y, and Z. But again, there can be side effects, and some of those herbal treatments can interact with other medications the parent might be taking. So again, if those questions come up, we would advise you to make that referral to your DBE. Now, people often ask, well, what about just copying a page out of the Medications and Mother's Milk book, or going to LactMed, which is a medication resource put out by the National Institutes of Health, which is designed for providers, by the way. It wasn't necessarily designed for parents, but nonetheless, you might be thinking, well, can I just tell a parent to go look it up? Well, here's the problem. That parent doesn't know any more than we do how that medication might interact with other drugs that she's taking, or might interact with or cause, or any kind of issues. For example, some medications can trigger postpartum depression. Some for parents who are at risk for postpartum depression. Some drugs can lead to a lower milk supply. Some drugs may cause other adverse outcomes. I know of some drugs that are actually considered damaging to people who are at risk for various types of liver disease. So again, we are not the experts. We don't know that person's medical history. And if you just copy off a page, that mother's going to look at that page and say to herself, well, this looks like it's probably okay. Well, it may be that that drug has been found to be safe for a nursing baby if the mother takes that drug. But again, we don't know her full medical history. So that's why we would ask that rather than copying things off and giving it to people, that you make the referral and allow the DBE to hand off information to the provider. Another thing that was on this list is advising a parent on how to manage mastitis. So the role and scope for a peer counselor is to support parents through the normal course of breastfeeding. Mastitis is a breast infection. It's a medical problem that requires medical treatment, and peer counselors do not help people manage medical problems. Therefore, this should be referred to your DBE, and honestly, it's not even a DBE's role to manage the disease. What a DBE will do is help the parent to breastfeed in the midst of this medical problem and be coordinating care and developing a care plan in collaboration with the parent's physician or provider. So just wanted to, clarify a few of these things. There's many, many other questions you might have about scope of practice, and we will come across many of that when we get to lesson 2C, which will be on Thursday. We'll be talking a lot about problems on Thursday. In the meantime, I see Leslie has put some information in the chat box that has more information about WIC policies for breastfeeding support, peer counselors, and the DBE role. So thank you, Leslie, for dropping that into the chat box. So if we could, let's go ahead and bring up the scope of practice. We're going to very quickly run through a few items that are in the scope. The scope of practice, and if you have this handout handy, you can bring that up if you want to use your yellow highlighter or pen and kind of put a star by a few things that maybe you didn't know before, that might be helpful. So we ask that peer counselors perform in a professional manner in all aspects of their role. So these are things that everybody in WIC does, as well as many of you who are community partners, respecting the person's privacy, dignity, confidentiality, being respectful to cultural attitudes and practices, working within the policies and procedures of the program that you work for, maintaining accurate records, making referrals when necessary, identifying situations beyond your scope of practice, and making appropriate referrals. For our peer counselors, we also ask that they yield. We use the concept of the yield to the WIC designated expert or in people, whoever's been set aside and determined to be the dedicated expert for your agency for any situation that is beyond the peer counselor's scope, and also to acquire ongoing education and maintain and build their knowledge and skills. And then we've kind of divided the scope into two sections. The first section is on encouraging and supporting participants to breastfeed using participant-focused communication techniques, helping families to identify the support that's available to them, and even educating their family members if it comes to that, helping parents identify their concerns, their barriers, offering solutions, basically helping parents fit breastfeeding into the context of their lives, teaching the importance of exclusive breastfeeding, promoting the WIC food packages for breastfeeding families, and being available to WIC participants beyond the usual clinic hours and outside the clinic environment. And of course, making all those appropriate referrals to help our parents access additional support. And then we're supporting them from pregnancy through growth spurts, introducing solid foods, all the way through the weaning process. So our peer counselors are, in essence, holding the hands of our participants all the way through their journey. They also teach basic breastfeeding to participants and help them when common challenges arise. So I want you to come to the chat box and let me know, like, what would you consider to be a common challenge that almost all new parents or many new parents might experience? So we can kind of get a handle on what would be considered normal, the normal course of breastfeeding. Yes, Alicia, latching, cluster feeding, growth spurts. Absolutely, Christina. This is a big part of what peer counselors do, reassuring parents who say, my baby is nursing all the time, what is going on, just helping them understand their baby's behaviors and normal infant feeding patterns. Sore nipples, yes, thank you for mentioning that. Dealing with parents who feel that who think their baby is not getting enough milk. Thank you, Brenda, for mentioning that one. That's another very important one. Many people really are making sufficient milk, but they doubt it. They have what we call perceived low milk production, not a real problem, but it's a perceived problem. And to the parent, it does feel real to them. So just helping them navigate that and helping them to understand what's going on. Christy says hunger, satiety, baby's feeding cues. Yes, a huge part of what peer counselors doing. My baby is hungry all the time, Stephanie says, I don't have enough milk. Absolutely. Dealing with engorgement and helping them. And I would add plug ducts are actually part of the scope of practice for a peer counselor as well. Positioning and latch. And I would like to offer this opinion that I think our peer counselors are exceptionally well skilled at helping parents position and latch their babies. So they are a wonderful resource. I've had peer counselors who can get a baby to latch when nobody else was able to do it. They are especially skilled with this. Time management, getting rest, eating well, pumping, going back to work, all excellent within the scope of our peer counselors. Not producing enough milk for the baby. So the only thing I'll say about that is if it is a true low milk production problem as opposed to perceived, then the peer counselor may need to also be making a referral to the DBE. And we'll clarify all of that when we get to the low milk production section on Wednesday. Oh, another good one, Brenda says, misinformation from the provider or from hospital staff. So yes, these are all in part or misinformation from family members. That one as well, Wilma added, or lack of support. This is all part of the normal course of breastfeeding. Thank you all for weighing in. It is time for our first break of the morning. I see that it's 9:20 your time. Let's come back at 9:30.
Welcome back from break, everybody. Kathy, I will turn it over to you.
Thank you so very much, Melissa. All right. Now, so before the break, we were going through that scope of practice, and I wanted to let you all know that if there were any other questions you might have about scope of practice, please feel free to drop that into the chat box so we can address some of the questions that you might have about this. Wilma also had added maybe the parent was given formula at the hospital. This can certainly be another big issue that happens, and peer counselors can provide some support to encourage the mother to not use those supplements if they are not absolutely necessary. I did want to mention that another aspect of the peer counselor's scope of practice is what we call hands off. And this is actually new to the curriculum. This was not in the previous peer counselor curriculum. And the curriculum states that it is beyond the scope of practice for a peer counselor to touch or handle the mother's breasts. Now, you might think, how are you going to help her latch the baby without that? But you know, there are ways to assist with positioning without actually touching her breast. You want to remember a couple of things. One is that the breast is a very intimate part of a woman's body. And we want to be very, very respectful. We don't want to be very cavalier about that. I remember when my first child was born and I was having trouble getting him to latch. And I was figuring it out. You know, he was latching, but I was struggling just a little bit to figure out what I was doing. And a nurse came in while I was trying to get him to latch. And I thought I was doing okay. I mean, I thought I was, I was just trying to kind of get him on. And she came in to like take vital signs and she said, "Oh, you're doing that wrong." And she grabbed my breast and grabbed him and basically shoved my breast in his mouth. And I have to tell you, that was traumatic for me. And I am fortunate that I did not have any traumatic experiences prior to that with being violated, but that was very, very, very upsetting to me. I told my husband about it and he was like, "Well, we're going to file a complaint." And I was like, "No, I'm not going to raise a ruckus," but it really unnerved me when she did that to me. Now, I know none of you would do that, but I just am letting you know people have sometimes very, very strong feelings about other people coming along and touching them. So we want to be very respectful. The other thing is that we also do know that many parents, particularly in low-income and disadvantaged populations, have been sexually violated. They have been traumatized already. And when we come along and begin touching them, that can be a concern. Now, I will tell you that it is the scope of practice for an IBCLC to handle a mother's breasts. I don't believe it is the scope of practice for a dietitian. I've asked in several states, and most people have told me that they do not believe that it is within a dietitian's scope of practice to touch a person's breast or an intimate part of their body. Now, it is in the scope of practice for a nurse. It is in the scope of practice for a provider. So we all need to know what are our limitations? What are we able to do? So instead of touching her breast, we would want you to do what this peer counselor is doing in this picture. Use a breast model and a baby doll, demonstrate what you want the person to do, explain that to her, and then allow her to touch her own breasts. But we can provide that guidance. If it turns out that you really cannot assist her without touching her breast, then you need to make the referral to the DBE. So Lydia just asked, is it the scope of practice for the expert? It would be your scope of practice as long as you have a credential that allows you to do that. So it would be the scope of a DBE if the DBE is an IBCLC, or if the DBE has a certificate or a breastfeeding a credential of some kind that clearly states in your scope of practice that you can do that. So that would be the answer there. You have to know your own scope to know whether that is in there. We have not done the work for you of looking up the scope of practice for every single 5-day course out there or certificate program. And those things change. Scopes of practice can change. And we just did not include that. What we say in this curriculum is you need to know your own scope and determine if that fits within your scope. So you, even as an IBCLC, I will tell you, I also try to use a hands-off approach. That's always my first go-to. I don't touch a woman's breast unless it is absolutely necessary. And then if I do, I ask permission first. I wear gloves, and I really start by putting my hands over her hands first so that I'm not directly touching her breast. And then if I still need to touch her breast, then with her permission, I would do so. There would need to be, there's a lot of caveats to that, and we're going to go through that in great detail when we get to the level 4 content, what this process should look like. We even have a video that we created to kind of show you what that conversation would sound like to help you. So when we get to DBE, Lydia, you will get much more information about that. Now, we also say for peer counselors, they should not be placing their fingers inside a baby's mouth or be trying to do an exam of the baby. That is beyond your scope of practice as well. And if an oral assessment of the baby is needed, then you would make that referral to your DBE. The DBE has the scope of practice to do that as long as their professional scope allows that. So again, you have to know what your own scope says. Milk sharing. This question has come up a lot as well, where peer counselors, we've had we've had 1 or 2 instances where somebody wanted to know, a peer counselor wanted to share her milk. She had like a freezer full of milk and wanted to know if she could share that with a couple of her participants who were really struggling with milk production. And the answer is absolutely not. That is not within the peer counselor's scope to ever share your own milk with a WIC participant. It is also beyond our role as a WIC program to be serving as a co-op, so to speak, where we connect mothers who need milk with mothers who have a lot of extra milk. The FDA actually has some information on their website on the risks and precautions for sharing milk. And as a WIC program, the national office has determined this is beyond WIC's role to be helping to connect people to one another whenever they need extra milk. So if a mother is needing extra milk, as a peer counselor, you should be making a referral to your DBE, and we will talk in level 4 about the DBE's role whenever those inquiries come and how you can handle that. Because honestly, if a parent is not making sufficient milk, then somebody with a higher level of expertise needs to be doing a proper assessment to determine what needs to happen and how they can support her in feeding her child. So with the WIC DBE, this designated expert, I'm just going to briefly cover what the DBE is. A WIC DBE is the person with advanced knowledge, training, skills, and experience in helping parents who are experiencing complex breastfeeding challenges. These individuals usually are IBCLCs or International Board Certified Lactation Consultants, or they might have completed some sort of state-approved training to manage complex problems. And we will go into much, much, much greater detail on the DBE. When we get to level 4, we're going to spend quite a bit of time talking about the qualifications and the experience that's required and what counts as appropriate qualifications, appropriate experience, appropriate training, et cetera. So we'll get into all those details in the weeds when we get to level 4. And Tatiana wanted to know what the letters DBE stand for. Thank you, Melissa. Stands for Designated Breastfeeding Expert. In other words, it's the person that each agency has defined or determined will be their go-to person whenever a complex breastfeeding challenge occurs. And ideally, every WIC agency will have someone on their staff who has received that advanced training and has sat for the IBCLC exam or whatever other state-approved training you all have authorized to move into that role. So the role of the DBE then is to receive referrals from WIC staff whenever complex challenges arise, and then they have the skills to be able to do an appropriate assessment of the mother and the baby to determine the potential causes of problems and to develop a care plan for this baby and the parent, which includes also making referrals to providers and other individuals in the community who have resources and expertise who can help with certain situations. So for example, here on the Gulf Coast, we have an IBCLC in private practice who is especially skilled at helping parents whose babies have a tongue tie. She's a nurse and an IBCLC. She's been in her role for probably 20 years. She's probably seen over 2,000 or 3,000 babies who have tongue tie. So whenever I encounter a parent whose baby has a tongue tie, I make a referral to her. I personally contact her and say, I have a mom who's experiencing her baby has a tongue tie. It's very obvious to me, but of course we want the provider to diagnose that. But I would like for you to see her. And then she, works it out to where she can then do the follow-up. So our DBE is going to be connected to all of those resources in the community to help parents get specialized care whenever situations arise. That may even include connecting parents to an occupational therapist or to a chiropractor or a bodywork specialist or a craniosacral therapist and other individuals who have specific areas of expertise that might be helpful for babies. So that is all part of what the DBE's role is going to be. All right, I don't know if there are any other questions about the peer counselor's basic roles and responsibilities. We have a lot of other content we'd like to cover today. But if there are any burning questions you all have, I want to give you that opportunity to do that. You can either use the chat box or feel free to just unmute yourself and ask your questions. So I'll pause here to see if anybody has any questions. All right, and Leslie, if there's anything else you want to add, you or Rachel, to what I've already been sharing with regard to scope, I want to allow you that opportunity if there is anything else you would like to say.
I think you did a great job of covering it, Rachel.
Okay, thank you very much, Rachel. And all right, then let's go ahead. I tell you what, before we move on to the next section, because we are changing topics here, let's do a real quick 1-minute stretch. All right, if you would stand up, do some stretching, take your eyes off of any kind of a screen, because we want to give your eyes a break from screen time. So look out your window, close your eyes if you need to, but just give your eyes about a 1-minute break.